Topic this week of training for AI in the healthcare workforce, and it's a bit of a two-parter, thinking about the need, the kind of problem statement, and then some of the training offerings that are out there. So for those of you that are joining us for the first time, at the incubator, our aim is to build a kind of cross-sector community of researchers, industry professionals and practitioners, trying to surface some of the challenging issues around AI innovation and move the conversation forward and think about potential solutions together. But before we dig into today's episode with these webinars that try and address some of these challenges, I'll just go through a few housekeeping points. So first off, you've probably got little messages dancing around the top of your screen already saying this is being recorded and transcribed. So that will be available online through our website, and you should get emails directing to you if you want to follow up on things later or pass it on. There'll also be some time for questions and answers, as well as some discussion. And with today's format, we'll do that in two servings. So please do add any questions into the Q&A section, which you should see at the bottom, a little button there as they occur to you. But we'll dig into them in a couple of chaired Q&A sessions after that workforce need section, and then some of the training options section. I think that's it for housekeeping. So please do, as well, as you'll see, there's a little comment chat, and you can share ideas about other training opportunities you're available or resources that others in the community might value. So let's kick off with the first half then, thinking about workforce training needs around AI. I think that's probably best characterized by the 2022 workforce, the 2022 two-part report on developing workers' confidence in AI from the now NHS Workforce Training and Education Directorate. And so we're very lucky today to be joined by George Onisiforou, who is an AI advisor within a team between DHSC and NHSE, who was also one of the authors of this report. So without any further ado, I'll just hand over to you, George. Thanks ever so much for joining us.
Thanks, Jeffrey. Thanks for inviting me, and thank you to everyone attending. Let me just try and share my screen. Please let me know if you can see this.
That looks great. Super.
Okay, great. So thanks again for inviting me. I am George Onisiforou, and I am part of a team of advisors working centrally at NHS England's Transformation Directorate around the adoption of AI technologies in health and care settings. So we were previously known as the NHS AI Lab, though that program is now being closed, and its focus was mainly in research, supporting trialing and testing of AI. But we will now move into an advisory capacity as a new team to support the adoption of AI technologies across the various NHS settings. Our focus, though, remains the safe and effective deployment of AI. And I think everyone on this call will agree that we can't achieve that goal without a workforce that is willing and able to engage with these technologies. We understood that at the NHS AI Lab, and what I will present to you today is the work that we completed in 2022 in collaboration with what was previously known as the Health Education England, to go about answering questions on what is the best way to prepare the workforce to be confident in AI. And I will talk about the complexities involved with that word confidence when talking about using AI. The specific question we wanted to answer was, what are the factors that influence confidence in AI amongst healthcare workers? and how can this be addressed through education and training so that we develop and support a workforce that is confident in AI. And we answered that across the two reports you can see here, which are publicly available and you may have already seen. So the first one focuses on understanding what confidence means in the context of AI and healthcare and what influences this confidence. And the second report focuses on determining the educational and training needs and suggesting pathways for related education and training. I should say that I worked on these reports with Dr. Mike Nix and Dr. Annabelle Painter, who were clinical fellows at that time, working across our team and Health Education England. And what we did was a literature review, but we also interviewed over 50 individuals in healthcare settings, in regulatory bodies, academia, the private sector, just to capture insights and inform our suggestions. And you can see the full list of that included in the reports. So one of the first things that became evident to us from the start is the need to create a framework around what influences confidence in AI. And you can see here what we developed. And this framework pretty much summarizes everything that we say in the first report. And what we are saying is that for AI used in any task in healthcare settings, it is ideal to increase confidence through establishing the trustworthiness of these technologies, initially through the governance settings and then through robust implementation at the local level. This is the part at the bottom where the arrows are. So the aim here is to increase confidence in these technologies. But when we're talking specifically about using AI in clinical decision making, and that's the area at the top, the semicircle, then we don't necessarily want to keep increasing confidence in these technologies, but we want to enable clinicians to determine an appropriate level of confidence in the information provided by the AI and balance that with all the other sources of information they have in front of them. That is the overall gist of the framework. And what I will do now is just briefly explain a bit more on what influences confidence in each of these three areas, starting with governance. As you probably know, governance settings play a key role in establishing the trustworthiness of AI technologies. And we heard from our interviews for this report that to be confident, workers want AI technologies to be included in formal governance and oversight through the regulation of AI products, healthcare settings, and workers themselves, and to include as well AI-specific elements in available standards. Workers also want to have confidence that AI technologies work in real-world clinical settings and have appropriate evidence through the different stages of validation they go through. This may seem obvious, but it does remain one of the key limitations in the state of AI in healthcare in general, in that we don't have enough real-world evidence. The importance of guidelines was also mentioned, whether relating to procurement, development, or clinical use of these technologies. And then, of course, the big questions in relation to attribution of liability that need to be resolved to shape confidence in AI. Implementation reflects one of the most consistent feedback we had during the interviews for these research that the safe, effective, and ethical implementation of AI in local settings contributes significantly to building confidence. And the comments we received focus on four areas that you can see there. What we heard is the importance of establishing AI as a strategic and organizational asset, including through developing strong business cases. The second factor is around technical implementation, and that refers to arrangements for information technology and data governance. We heard that a lot of the challenges then, and I think this is probably true still now, for deploying AI relate to these arrangements. And we got the impression that unless these are clarified, many clinicians will hesitate to use AI. I've mentioned evaluation and validation, and local validation is part of that, which is the third factor here. And we've heard the importance of local validation, which may be needed to ensure that a system with good published data will generalize well in local situations. And the last factor is systems impact, essentially being confident that AI is properly integrated in clinical workflows and pathways. The last area I'll talk about is clinical use, and this is when a clinician needs to make a decision for a specific patient based on AI-derived information and all the other information they have in front of them. And as I said at the beginning, these situations, we would want clinicians to feel that the technology is trustworthy, but we don't want them to be inappropriately over or underconfident in the information that they are receiving. So we want them to be able to assess the appropriate confidence that they would have for the AI-derived information for that specific patient. And what we've heard is that that is a complicated challenge, as many factors can influence a clinician to either be inappropriately over or underconfident, which you can see there. We go in a lot of details about this in the reports, but I will mention the influence of cognitive biases, which they could be a report on their own, and we list different types of biases in our report, like automation, confirmation bias, and alert fatigue. So the reason why we developed this framework in the first report was to be able to identify education and training requirements for the workforce, which is what we're listing in our second report. So we took that framework and answered the question, how can we address these factors that influence confidence through education and training, so then that as an outcome, we can develop confidence in AI amongst the workforce. And we propose 3 steps, though this doesn't mean that they cannot happen at the same time. There's the educational groundwork, which is continuing efforts to enable the adoption of change and innovation and advance digital skills and capabilities. And then there's development of general AI education and training programs, which can be aimed at the whole workforce to provide that foundational AI knowledge, and then more advanced offerings that are specific to different roles and responsibilities that one can have. And I'll talk a little bit more about that in the next slide. And then the third area is the provision of specific training for each AI technology or product that is conducted during the product deployment. So as I said, I've talked about providing advanced education that is specific to the different roles and responsibilities that workers may have in relation to AI technologies. And what we did in the report, and eventually has been the most influential aspect of that work, is identify 5 archetypes and then suggest specific educational requirements for these. And you can see the archetypes here. They're the shapers, the drivers, the creators, the embedders, and users. They're pretty much self-explanatory, and you can see the descriptions there. But what I thought I'd do is just go a bit more in detail in relation to the drivers and embedders, given these are perhaps the most relevant to the group attending today's session. So drivers are the ones who champion innovation and transformation at regional or local levels. And for a lack of a better word, they literally drive the development and deployment of AI technologies. They are regional and local NHS leaders. They also make decisions on procurement, funding, and resource allocation So they can be ICS board members and clinical commissioners. They lead the system change and implement local governance infrastructures to ensure effectiveness and safety. So, individuals like chief information officers or chief clinical information officers, PMO leads and service leads. And in the report, we talk about how drivers need to be equipped to know what kind of questions to ask when considering AI in their settings and when procuring AI, and be able to critically appraise their options, or at least find the experts to do so. We're also talking about the importance of drivers developing the right culture at their settings, and that includes innovation, inclusivity, fairness, and multidisciplinary collaborations. And we recognize that education resources for these individuals should be flexible, efficient, and accessible. Um, Embedders are definitely closer to local settings, and most of the time exclusively so, and they help implement the AI technologies. They can have varied responsibilities ranging from technical implementation, data governance, clinical safety, evaluation, and ongoing monitoring. So they can be specialist digital clinicians, digital data and technical data professionals, individuals in IG and IT teams, clinical safety officers, and so on. And for embedders, we recognize that they need to understand a broad range of topics, ranging from governance requirements to evaluation and technical knowledge. So perhaps these are the most demanding of all AI roles, which also means that their education needs to perhaps also be the most demanding. We recognize that these individuals can have specialist skills as well that may require further workforce transformation to ensure the healthcare system is sufficiently equipped. So we're talking about the professionalization of embedder roles and needed skilling. So it's great to see the work that Jeffrey is doing in relation to and the others that we will hear today in relation to supporting these types of roles. So I'll stop here and maybe perhaps take some questions.
Thanks very much, George, for walking us through that so clearly. We've got one question and comment that's come in already, just about the potential complexity that comes if individual endpoints and evaluations need to be run for a range of different AI technologies, and whether or not infrastructure like AI orchestrators or deployment platforms have a part to play there. Do you have much of a sense of the balance of how some of that complexity might be picked up by workforce, or how some might be picked up by new infrastructure like orchestration platforms moving forwards? And I appreciate it's a little bit out of the scope of the report.
No, it's fine. I think, I mean, the answer to that would be a combination, really. I think both would just interact and influence each other. I take the point that the way that these technologies are deployed could actually influence the skills that are needed. So I can see kind of a connection between the infrastructures and the needs locally, and not just in relation to evaluation, but even in terms of IT arrangements and things like that.
And we've got another question just come in as well, and I know in the report you spelled out learning outcomes for these different roles in great detail, which is super helpful. The question is, what skills can one begin to adopt to prepare one for the future of AI in the NHS? Are there any kind of priorities you point to, or anything you can?
So I mean, as I've perhaps the 3 steps that we suggest as a general approach to education um, answer that question. Um, I think it's important to always consider that educational groundwork that is needed for AI, and we are talking about uh, more general digital literacy skills and capabilities that are quite important. And then we're talking about some foundational general knowledge that can apply to everyone in whatever role they play. And we list some areas on sort of basic AI literacy and awareness in relation to that. And then what we're looking is advanced knowledge pending on the role. So, to answer that question, you also need to know what is the role that each individual will play in relation to the deployment of these technologies. And that's why we created the archetypes to suggest that perhaps depending on what your responsibilities would be, you may need to look into different types of knowledge and skills needed. And the last bit, which is just as important, is product-specific training. So that's topical training being provided when a specific product is deployed. That's important as well. If we're talking about holistically the safe and effective deployment of these technologies.
Thanks very much. And I think you probably answered one of the next questions that's come in there unwittingly as well, whether or not there are opportunities for nurses to be part of it. And it sounds like absolutely, as you say, it's sort of role dependent, but there's no kind of disciplinary limit on who should be involved and how. And hopefully we'll speak to that a bit in the training bit as well.
Yes, no, absolutely. That's right. So everyone should be, everyone can be involved and should have the at least kind of like that foundational AI education, and depending on how they will end up using uh, some AI products, and they vary quite a lot, as I'm sure you know. Um, um, they need to be enabled to use them safely and effectively.
And before we move on to the next section, and we may be able to come back to some of these later, but just one last question for you, George, from Hissa Al Abdul Salam. In terms of governance and regulations, do you think we should evolve from our current standards or revolve? So I suppose that's speaking a bit about the processes we have as they are, the roles they have. Is this just an expansion or a complete sort of paradigm shift, do you think?
That's a difficult question to answer. Also, because I know that there's a lot of even MHRA has recently launched a regulatory sandbox project just to see how they can innovate in terms of regulatory approaches to AI. And broader, the government has launched a regulatory innovation initiative as well. So I can see a lot of developments, from the regulators themselves and also the government around sort of thinking things differently and innovating at that. So I would say that's probably the right direction.
Great, thanks very much. And thanks to everybody online for contributing so many questions and thoughts. If there's time, we'll circle back to them, but this is really helpful for us in the incubator as well to think about other issues to kind of address moving forward too. So thanks a lot, George. And so next we pivoting a little bit to think about different training opportunities that are out there. And we'll be dropping some links in the chat. Obviously, this is not a new problem or a problem that just one or two actors are thinking about, and there's lots of excellent resources and links and programs available. For example, there's a curated kind of catalogue of different online resources that the NHS Workforce Training and Education Directorate have pulled together, and we'll be sharing the link to that. The British Institute of Radiology have got a fantastic online seminar series. But next up, thinking of the kind of embedder and driver roles that we've mentioned, there's a fantastic opportunity for mid-career healthcare professionals from all sorts of backgrounds, such as well-established, already, I think, currently looking for its 4th annual cohort, which is the NHS Fellowship in Clinical AI. I'm really pleased that we can have Beatrix Fletcher here today, one of the senior program manager for that fellowship, just to tell us a bit about it. Hi, Beatrix. Over to you. Thanks so much for joining us.
No worries. Thank you so much. And nice to see everyone. Well, I can't see everyone, but I know you're there. So actually, it's a fantastic segue. So we're from the NHS Fellowship in Clinical AI, and we actually based our program based on the documents that George was just mentioning. So targeting those clinicians and, as Jeff said, mid-career NHS staff that are wanting to be those drivers and embedders, and what we felt like they might need for that. The approach that we've taken is all about sort of a hands-on, real-world experience. So the fellowship is a paid apprenticeship style program where participants work directly within organizations to solve AI challenges with supervisors. So working side by side, teams that are working to adopt AI into their clinical setting. And it's designed for those who sort of want to dive straight in to the practical application, learning by doing rather than traditional coursework, and keeping their clinical jobs alongside. So yeah, that is sort of just a brief overview of what the fellowship is trying to do. As Jeff said, we're in our 4th cohort, recruiting at the moment, closing next week. And we have expanded from London, which was in cohort 1, to most regions of the UK now, and also expanded to a lot more workforce groups. As the previous question just pointed out and George reinforced, we are very much of the opinion that this is a multi-professional problem. And so we need multi-professional teams to come together and make sure that any product that comes into the NHS is for us and designed with our staff and our patients in mind. I wasn't sure, Jeff, is any specifics that are necessarily interesting?
I think that's a brilliant overview of what is a great opportunity, and we'll have a Q&A session at the end as well for people to jump in at. So,
of course, great.
If you're all right to stay with us till the end,
No
we can circle back. Thanks so much.
No
So I'll just share screen next to tell you about another training resource that we're just launching in Birmingham to try and add to the capacity in the system and the different ways that we can address those training needs, particularly around that embedder and driver role, which is a new MSc in AI implementation coming out of Birmingham 25-26. It can be taken 1 year full-time or 2 years part-time, and has a number of different modules. But again, thinking of the audience here and the kind of flexibility that's often required to fit around professional commitments and other things, we're just going to zoom in on the 3 new modules that are being added. So the full program has other aspects like an established module on bioinnovation, which thinks about needs-led innovation, also some public health modules for wider context, and then a practice-orientated dissertation. But these 3 modules are made up of sort of 1 week block teaching, sorry, and can be taken independently. So hopefully offer a little more flexibility. So to kick us off, I'll hand over to co-module lead for key concepts for AI-enabled practice, Professor Slava Jenkin, who's chair in data science and government. So hopefully you're out there, Slava, and I can hand over to you.
Hi. Since I don't have the control of the screen.
Oh yes, please do. Just give me a poke.
Okay, right. So that let me just start with the first module. It's a foundational module that we bring in for the MSc that Jeff just mentioned. There are two module leads, so Jeff and myself. And as you can see, it's an interdisciplinary team. We're bringing together expertise from healthcare. I'm positioned in two different schools with two different disciplines. So I have an appointment with computer science, but also with the School of Government. So we're bringing this public sector perspective, but also computer science perspective to the module. So the purpose of our module is to focus on the professionals, working professionals, equip them with the knowledge and skills that they can lead on responsible AI implementation. And I would underline the responsible AI component because it's also crucial, as you will see in a minute, with the topics that we cover. So the goal is to develop understanding of AI technologies, but also understanding the tools that can be used in real-world applications. And one of the crucial things that we try to develop in the module is to develop this critical thinking about applications of AI and embedding AI in professional practice, whether it's going to be in healthcare or in public policy. And we view the participants in the module as people who will lead on these innovations, lead on embedding AI. So it's leadership in ethical and also interdisciplinary AI innovation. Can you please go to the next one? Thank you. So we will cover roughly 4 basic themes, foundations of AI. And here we will focus on traditional AI. And this is ancient stuff. It's more than 2 years old. So it's really old stuff. But we focus on machine learning, predictive analytics, and how it can be embedded into the decision support. These are the things that we've been doing for a long, long time. We know how they work. We have much more visibility about what's going inside the boxes, not the black boxing, but trying to unpack the black box without making it transparent or white boxing it. But also we will move to something that is really recent. And I mentioned 2 years just because we just celebrated 2 years of ChatGPT. But it's the generative AI component where we will look at large language models and their applications in professional context. And we will generate the critical thinking about the differences between the two approaches, but also what are the challenges of deploying that. And that links up to the responsible AI practice. What are the ethical considerations of deploying such systems? So it's bias, fairness, accountability. What are the governance frameworks? How does it align with policy and sector-specific regulations in healthcare, but also more generally in public sector? And then we look at data, the role of data, the quality of data, privacy, but also the impact of data on AI performance and making this crucial connection between the old adage of garbage in, garbage out, but look at how it also works in traditional AI models, but also crucially how the same principles apply to the LLM. And here we can think about not only the data that comes in, but in the structure of LLMs that can be within the retrieval machine generation, what kind of documents you're using for reference, but also the prompt structure. So the prompt engineering component as a new avenue for this data in, garbage out. So that's the data. And we also look at how do you evaluate the output. We are pretty clear about what we do with traditional AI systems. We have established methods. And then we are looking also at generative AI. how do we evaluate the output of generative AI systems? If it's text generation, there's one component. I will look at images, another component. And then one of the really important things that we discussed that we really need to develop is the hands-on experience. And here, thinking about participants that they're probably coming from non-mathematical background, non-technical backgrounds, non-engineering background, we want to have hands-on experience, but using the no-code approach. So we will be using LLMs for the text-to-code and text-to-model workflows to highlight how to develop some of the systems and how to deploy them for really narrowly defined tasks. And then applying the system, how do you tailor solutions to real-world problems? Can you please? Yeah, thank you. So what makes this module unique? It's designed for non-technical professionals. We don't require any coding. It's interdisciplinary faculty from healthcare, government, and tech. And we have this practical focus on tools to give first-hand experience about what it is to deploy such systems, but also how AI can help in deployment of the systems. And as Jeff mentioned, one of the crucial things, and I'm just repeating it to emphasize the point, it's a 1-week intensive teaching format, a block teaching format, which should work much better for working professionals. So it can help you in many ways. The module, from applying the tools to solve real-world problems across different sectors, gaining leadership skills to implement AI responsibly, within healthcare, evaluating clinical AI tools and improve patient communications. And it serves as a foundation to other modules that we will discuss in the program. In government, it's the use of AI for policy analysis, for citizen engagement, and for NGOs, it's using AI, for example, for crisis response, for all kinds of challenges that we face. Right? Thank you. Yeah, that's it. Thanks a lot.
Thanks very much, Slava. And next up, I'll hand over to Dr. Anirban Dutta, who's an Associate Professor of Quantitative Biomedicine. And along with Alistair Denniston, leads the Quality Assurance for Healthcare Technologies module, or short course, as it may be. I hand over to you, Anirban.
Can you hear me?
Yeah, that's great. Thank you.
Yeah, thank you, Jeffrey. So I'm Anirban Dutta. I'm the Associate Professor of Quantitative Biomedicine at the University of Birmingham. And my background is in neuroengineering. So for like almost 20 years now, starting from my PhD, I have worked on implantable medical devices, combining hardware and software. And since these goes inside the body, so we had to kind of follow the strict regulatory pathway, even in the academia. So this module is kind of based on my experience and also how this fits into this this scope that was highlighted in this meeting. So alongside Professor Alistair Denniston, I co-lead this module on quality assurance for healthcare technologies. And my presentation is going to introduce this module on quality assurance. So the first question is, why quality assurance, or what is quality assurance? Now, quality assurance is this structured process of ensuring that the healthcare technologies, they meet the highest standards for safety, reliability, and functionality. So this isn't just about compliance, like I think George mentioned, so it's about creating confidence and trust in these systems. So now, yeah, so thanks, Jeffrey. So now the next slide is on this. No, sorry, previous slide, please. Yeah, I was just, yeah, thank you. So now, as you have noticed from the previous presentations, that this takes a multidisciplinary approach. So in this module also, we're going to take this approach, primarily focusing first on this healthcare technology domain, which sits at this intersection of engineering, medicine, and ethics. For example, when deploying an AI model in a hospital setting, one needs to understand patient, clinician, and other stakeholder needs. Then one needs to also understand what are the technical limitations. So this kind of connects to this George's implementation part. And then also the ethical implications of implementing AI model into this whole clinical pathway. So this is key to implementation. So through this module, one will gain exposure to this perspective, this multidisciplinary perspective, empowering one to contribute effectively from kind of start to end in this implementation. Next slide, please, Jeffrey. Yeah, so now I wanted to kind of highlight this like the module focus. So the learning approach for this module is to emphasize on why over the how. So in quality assurance domain, we know that we often focus on this processes as the how. However, the real impact comes from understanding the why. So why do we test these and validate the systems? Why do we enforce strict standards? Because every decision ultimately impacts patient safety and trust in healthcare. So by prioritizing why, one can develop a deeper connection to the purpose behind this quality assurance work. And of course, I mean, that makes especially embedders and drivers just not just a practitioner, but a problem solver and innovator when they go about implementing this in a healthcare setting. Next slide, please. Yeah, so now, so this module is kind of driven by these three aims. So the first aim of this module is on this quality assurance in the healthcare technology domain. So the first is to introduce different principles, standards that guide the development of safe and effective healthcare technology. So these tools involve understanding regulatory pathway, quality assurance protocols, and ethical considerations. So this also includes compliance with industry standards. However, it's more on incorporating user-centered design to address clinical needs and applying rigorous testing and validation process to ensure safety efficacy. So all regulatory aspects of that would be covered, and that's the first aim of this module. Next slide, please, Jeffrey. Now, the second aim is on the quality assurance in the medical AI and ML systems. So you just heard from Slava that so there's this shift from code to the data. So traditional AI systems, they were like mainly rule-based, so one could easily perform risk analysis on them and could test those quite well. But now with this generative AI, it is all about data. Yeah, so so that poses challenges such as ensuring data quality, addressing biases, maintaining transparency and explainability, also navigating this evolving regulatory compliance. And this is where it would be very dynamic, the course content will be very dynamic, driven by the developments in the regulatory domain in this area. And these challenges highlight the need for a systematic multidisciplinary
And we may be having a bit of a technical hitch here. I don't know if you can hear us, Anirban, but we can't hear you, I don't think. Unless it's just me. Well, thank you very much for getting us 80% of the way through there. I'll just fast forward through the last one because we've got one more short presentation to cover, and then we can always loop back with questions and answers at the end. So I'm just going to briefly speak to the final module that we're talking about here, which again is delivered in a 5-day block teaching and can be taken as a short course. Well, that's the plan anyway, a few little governance hoops to leap through there. But the aim of this is a very pragmatic focus on what's required to lead responsible AI implementation projects within a healthcare provider organization. It's a module I'll be leading with Dr. Xiao Liu, also from the incubator team. And the key goals are really to select and apply appropriate methods to look at the different forms of risk that are related to AI being brought into use in healthcare organizations, and to communicate the risk and the evidence of its management to the different parts of the organization, different decision makers, in ways that are meaningful and that help to affect change and progress the projects. There are lots of frameworks describing the process of AI implementation. Here's one which comes from the Health AI Partnership, which is published back in 2022, and a project I was involved in, which is why I always reach for it. But essentially, part of this is about process of activities and the order that they take place, how to do them. The wider MSc program will focus on different parts of this journey. Like I mentioned, problem characterization in that bioinnovation piece. But in this module, we'll be thinking more about what success looks like at an organizational level, methods for building kind of consensus on that, and aligning key performance indicators with that, how it should be measured. Thinking about the workflow that AI sits within, how to map it, and think about how it might serve those success measures without being too disruptive. A lot of focus on evidence generation, evaluating safety, effectiveness, and equity. And that's both through appraising existing evidence, so we'll be talking about critical appraisal of published AI literature and that kind of thing, but also how to plan and generate local evaluations. Executing AI solution rollout, obviously that's a bit of an understatement, some of those change management techniques, and then thoughts further down the road to a sustainable implementation, so how to monitor that these solutions are still working and how to turn them off. And the other part of it is thinking about the actors and structures within an organization that allow this to happen. So this is really variable, but having a sense of what the different kind of risks are: clinical risk, cyber risk, information governance risk, who the different decision makers are and risk owners within a healthcare organization, and what kind of information or reports we need to help them make decisions and how to work together. So we're not aiming to be an expert in all these kind of domains, but to kind of have a foot deep, mile wide competency to help navigate the process. And as I mentioned, we'll be able to draw on some of the work like medical algorithmic audits that Xiao Liu led, and other methods as well, to try and plan how to generate some of this evidence locally rather than just relying on research evidence and external evidence to see how things work in context. So there's a little bit of an overview, and as I say, there's a flexible offering there of the different ways that the modules in the program can be engaged with overall. But just as we come towards the end of the session now, I think we've got a bit of time for Q&A. I'll just have a little look through the chat as well. As mentioned, please do include any extra resources or other things you'd like to signpost. Just having a little look there. Whilst with thinking about any kind of questions around these different resources, Beatrix, I wondered if I could circle back. I know you mentioned that there'd been a kind of broadening scope of different fellows applying. I'd just be really interested to know what the kind of trends there, what kind of workforce groups you're reaching, and who's enrolling. I know the application is not quite closed, I don't think, for this fourth cohort, but
yes, so the applications for cohort 4 close on the 18th, so next week. And yeah, we have found the appetite to be equally insatiable across most workforce groups, which I think reflects where we are in the use of AI in general. Most workforce groups understand that they will be impacted by this, and they can see the draw to sort of getting ahead of that curve as much as possible, getting the knowledge that they can, so then when it lands at their feet, they know what to do with it. So yeah, this year we have some dentists, pharmacists, public health doctors of most specialties, physiotherapists. We've had lots of applications from nurses and midwives. I I think optometry is also eligible this year. And we're pretty open to any workforce group that's interested in applying. What we're limited by is the specific funders in each of the regions, and the pots of money that comes from has a historical pre-AI model that kind of determines which groups those pots of money look after. But in any region where we have any of those restrictions, we're very active at trying to find other sources and very open to any ideas people have.
Thanks very much, and hats off to you for navigating all of those complicated and locally held pots of money.
Yes, yeah, lots of negotiations, lots of partnerships. Not something I thought I was going to be part of.
I was wondering, George, if you're still there as well. I noticed some questions from earlier on, circling back here too, about the distinction between primary and secondary care needs. Is that either from the workforce report or something you've encountered in ongoing work? Do you see much of a distinction between the training needs for members of the primary care workforce or secondary care workforce, or differences in the kind of challenges that they're having to meet?
So it's probably a combination of having some commonalities and some differences, but it is also driven a little bit as well in differences in the types of AI products that may be picked up in other of the settings, and we're seeing a lot of interest currently from general practices, particularly on AI in the non-medical space. So AI that provides assistance with sort of like back-end tasks and documentation and workflow support, as opposed to sort of clinical support. So some of those differences may as well dictate kind of like the needs in terms of education and support. But the other thing to note is the settings themselves have different types of needs in general, both in the way that they sort of funded and procured, but also in the amount of resources that they have, including sort of human resources. So those things as well dictate the type of support that they might need in deploying AI as well.
Yeah, no, that's a good point, and a real challenge in building the kind of resources to try and help address all of those different kind of needs. So good to see the diversity of different resources out there, and I guess that's set to grow. Brilliant. Well, thanks ever so much, George, and all the speakers that have joined today, and all of the audience too for dialing in. I really appreciate your time. I'm just mopping up a few kind of more administrative questions in the Q&A. Just to say that if you registered for today's event, you should be invited to other incubator webinars into 2025. And also some questions about where these different programs can be found. So I think we've got links in the chat if you want to do a quick copy and paste, but we'll leave the meeting running for a little bit, of the fellowship application page, the MSc page, which is evolving as application windows come open, but hopefully it gives you a direction of where to go. I think hopefully that addresses most of the things there, but as I say, we will have a look over those questions and carry that into next year. On that note, our first talk in 2025 also lines nicely up with some of the conversations here, which is going to be from Dr. Taf Ahmed, who's a clinical fellow at the CQC, who's leading a project looking at AI use in primary care, and I'll be kind of updating us on where he is with that, exploring the level and nature of AI use, which is often a world that's not easy to connect to, at least from secondary care, and it's not clear always what's being used where. So that'll be really interesting. But all that remains really is to say thank you once again. The recording will be available, and we'll be in touch in the new year with the webinars to come. But I know it feels a long way off, but I suppose it's Happy Christmas and Happy New Year in the interim, and look forward to seeing you next time. Thanks again to our speakers. Bye.
Bye-bye.